People are patients only a small amount of the time, but they're humans all of the time. But in healthcare, we do so many things to inadvertently dehumanize folks. What we're focusing on now in terms of HeartWiring is giving our providers tips on a weekly basis.
Hi, I'm Chris Malone, and I'll be your host for today's discussion. Thank you for joining us. Today, we'll be talking with Dr. Reg Blaber, EVP and Chief Clinical Officer at Virtua Health. Welcome to the program, Dr. Blaber.
Thank you for having me.
So to get us started, can you tell us a little bit about your role at Virtua Health?
As the Chief Clinical Officer, I am responsible for the most part for clinical operations. And by that, I mean the safety and quality of the care that's offered here, the experience that folks get. We have a very important academic affiliation with Rowan University that I steward. And then there's a number of other things that fall under my portfolio, but I don't think necessarily worthy of this discussion.
And then for those who might not be familiar with Virtua, can you tell us a little bit about Virtua and where you're located and types of communities you serve?
Virtua is a 5-hospital health system in southern New Jersey. Our 3 main counties that we serve are Camden County, Burlington County, and Gloucester County. We have 5 hospitals across those counties, and we employ about 1,400 physicians. Have about 41 joint ventures with ambulatory surgical centers across 3 states, and have about 300 plus locations.
And so I'm wondering, is there a story that you can share about how you personally chose a career in healthcare?
When I was a little kid, I went through the phases of wanting to be an astronaut, a police officer, a fireman. And when I told my parents I wanted to be a doctor, they latched onto that one. My dad was a salesman, but he was amongst a family of physicians. So he was the black sheep in the family. So I think he was redeeming himself in his eyes by when I told him that I wanted to be a doctor. And really from that moment on, I didn't want to be anything else.
So, over the last few years, it seems like there's been this growing interest in the idea that healthcare needs to become more human. I think especially since the COVID-19 pandemic. What are your thoughts on this? And does healthcare need humanizing in your view?
Although I think it predates the pandemic, I will say the pandemic exacerbated it. If you think about a time where we were all wearing masks, where we were separated from each other, if not emotionally, very much spatially, with the 6-foot rule. And, so many of our docs and nurses would come home from work, they'd strip out of their clothes, their family would be upstairs, and they would go downstairs. And so there was this real estrangement of families. Not only here at work, but doctors and nurses not being able to see their loved ones at home. But at work, it was very much the same. I mean, just think about how a face mask really changes the way we look at and perceive each other. It's tough to even understand what you're thinking just by looking at your eyes, how you're reacting emotionally. But as I said, it predated that. If you think, I've been practicing since the early 90s, and medicine has changed so much in that time period. And I hear about it especially from the docs who are older than me. If you think about the introduction of electronic health record and how that computer screen more and more has come to sit between me and my patient. I've had patients tease me about, having a better relationship with my computer screen than I have with them. And, they're sending a loud and clear message when they tell me that. And at the same time, there's all these economic forces that with the corporatization of medicine and whatnot, and a lot of things being driven by the government, whereby we're being asked to see patients more and more quickly. The focus becomes on documenting what I have done so I can bill for it, as opposed to, focusing on what you need, what matters most to you in that moment. And so there's this, I think, conflicting forces that are up against each other that have physicians in particular, but also nurses and other healthcare providers really finding themselves at a crossroads of is this what I signed up for?
Absolutely. And I think you mentioned a couple of things. There are these things that have intervened in the way that we naturally interact with one another, right? Whether it's the electronic record system or COVID and the masks, and it's disrupting the things that we kind of take for granted and how we socially interact. And only when we have that interruption do we start to recognize how much of a difference that makes, essentially.
I agree with you, Chris.
I heard you speak at a conference recently about how Virtua Health has been focused on HeartWiring what matters most for everybody always. And I was wondering if you could tell us what that means and how that all came about.
Well, obviously, HeartWiring is a play on words with hard wiring. And as a physician executive and health system administrator, I do my best to hardwire everything I can. We want to standardize wherever we can and create processes. And that's so important in medicine because there are so many areas where if you're not following a process very closely, people can get hurt. The problem is that if you're only telling people what to do and not necessarily why to do it, you're not going to get great compliance with that. And even a step further, if you really want to be successful in ingraining something into those on your workforce, you want to go beyond the head. You want to connect the head to the heart. So when you talk about the why, you've got to talk about why it matters to their patients. Why, and in doing so, you're tapping into their purpose, why they got into healthcare in the first place, and their passion for healthcare. Absent that, it's just sort of, hey, you're asking me to do another thing? Are you kidding me? And that's especially the case nowadays, especially post-pandemic. So our goal with HeartWiring is truly to connect the head to the heart and shape behaviors by tapping into the emotions of our providers. Chris, that it's the amygdala that is where emotions arise. And the amygdala is a much more primitive, but also much more powerful driver of behavior than is the frontal cortex. And so if I tell people why it's important, you know what? They're going to do it when it's convenient if there's no emotion involved. But if there's emotion involved, they will do it every time, even when it's inconvenient. And that's our goal by HeartWiring things.
That's really well put, Reg, in the sense that 80% of our behavior, social psychologists tell us 80% of our behavior is driven by those emotions. It's not by the rational, logical thinking part of our brain. It's that stuff where we feel it and it moves us and we act. So it's a really great explanation. So can you tell me some examples of how you have been heartwiring what matters for patients at Virtua?
The first thing I'm going to tell you is I think we got it wrong for a long time. You asked about patients, but I'm going to start with colleagues because, I would go into a room and I would tell the docs and nurses, hey, you need to, when you're going into a patient's room, you need to knock on the door. You need to sit down, show them you have time. You need to make eye contact. You need to lean in. You need to touch them. And here's a script for you to use. And it never worked. It never worked. And obviously, I was telling them what to do with great reasons why, but none of it had anything to do with tapping into their emotion, their purpose, their passion as to why they're doing what they're doing. And I came to realize at some point that I had it all wrong. In order for our patients to get what they need, I needed to first make sure that our care teams, our docs, our nurses, our techs, our therapists, all got what they needed first. It was then that I started thinking differently about this problem. And that is, our patients are telling us they're not happy. Well, and I'm talking about not just Virtua, I'm talking about the whole country. Our patients are telling us they're not happy. Our providers are telling us they're not happy because they're retiring early. They're leaving the workforce in droves. You have to ask yourself why that's happening. And in my view, the reason that's happening, and I'm going to lean back into what I mentioned a couple of minutes ago, is that there's so much separating us from our patients. We've not been connecting with our patients in a human-to-human fashion, creating that emotional bond. So the EMR, the rapidity by which I have to go through patients, that becomes the focus of me. And when that becomes the focus, then my interaction with you as my patient becomes transactional, right? So if I'm seeing 25 patients in a day, that's 25 transactions. It's like I'm standing at the Acme, just hitting the cash register, cha-ching, cha-ching, cha-ching. I go home, I'm exhausted, and I feel empty because there was no human interaction. And this has happened to me, Chris. So I'm not speaking for everyone, but I think I speak for a lot of people who've been in that similar situation. And so, what we've tried to do is with our docs and nurses is to first of all recognize the moment that we're in, to tell them, you know what, we've handled this, probably haven't handled this as well as we should have in the past. But here's the world as we see it now. Ask them if we're right, and we've gotten affirmative answers. And so what we'd like to do is to help you better connect with your patients from a human to human standpoint. And I use human importantly because in healthcare, people are patients only a small amount of the time, but they're humans all of the time. But in healthcare, we do so many things to inadvertently dehumanize folks. What's the first thing we do when they come into the hospital? We make them take off their clothes and put them in a closet. Then we put up the side rails and say, don't put the side rails down unless you call for me first. There's so many things. I could go on and on. What we're focusing on now in terms of HeartWiring is giving our providers tips on a weekly basis to help them better connect with their patients. If you'd like, I can give you an example. I watched this tip one day, and the tip was about a patient who had written a letter complaining about his doctor. The patient had gone into the hospital or gone into the office and had complained of back pain. And the doctor did a full examination of this woman, great physical exam, great history, reassured the woman that the back pain was neither neurologic nor musculoskeletal, and sent her on her way. Well, in her letter, she said, this pain is exactly like the pain that I had when I had a kidney infection, but she hadn't mentioned it to the doc. So they said, when you get a patient like this, ask one question. What is it about all of this that worries you the most? So I was a skeptic about all this. I watched this video. I said, all right, I'm going to bring this into the exam room with me. And so a patient came in and she had elbow pain. And I'm a cardiologist. Well, 10 minutes into this discussion, I already knew her elbow pain wasn't from her heart. But I had just watched this video and I said, what is it about all of this that worries you the most? She started crying. And she said to me, Doc, my brother, right before he died of a heart attack, had elbow pain. I've been practicing for 30 years, and I'd like to think that I have great relationships with my patients. But what I've learned to be is more thoughtful about the words that I use, the words that I choose to use with my patients in order to connect with them in their moment of need. And honestly, in my 30 years of practice, I have never been happier seeing patients because of the new relationships that these tips have helped me with. And we're seeing it across our health system as well, with testimonials from our doctors and nurses who are participating.
Well, it's a great story and a great example, and it's a great illustration of that the needs of the patients are in many respects very similar to the needs of the care providers. We're all human, as you said. We have the same emotional need for that connection. That's the emotional fuel that gets them out of bed every day to be able to take care for folks. And so you can solve, the challenge and the strain and the burnout with the same cure, allowing them the time to make that emotional connection.
You're exactly right.
So where do goals and progress metrics? You said, this is really about kind of tips and allowing the providers to get what they need first. Is this something you've been able to measure? And if so, how do you go about that?
Yeah. So I think about things in this regard. We've been doing this for just under a year. So I think about things in this regard as leading indicators and lagging indicators. So the leading indicators for me would be, our level of colleague engagement, which we measure every year. In fact, we just measured it and we just got our results back. I'll come back to that. We look at it in terms of colleague, especially physician burnout scores. We have a baseline, but we do not yet have the follow-up on that yet. Turnover of both physicians, nurses, and other parts of the organization. Those would be my three leading indicators. I can tell you that on our press gaining colleague engagement survey, we've seen a material increase just in the last year of that. And also, we've seen a similar increase in our colleague in our culture of safety score as well. In terms of lagging indicators, the things I think about there are HCAP scores. So especially as it pertains to physician communication, did my doctor communicate with me? Did my nurse communicate with me? Was the staff responsive to my needs? And for those who don't know, HCAP scores are CMS mandated surveys that go out to patients, Medicare patients who come to our hospitals. And so they fill it out voluntarily and send it in. And, health systems across the country don't typically do great on this score. And so we're a year in, and we've seen significant improvements in those three scores. But even more impressive than that, Chris, is our net promoter score for the organization. So I think we were already a pretty strong organization. We started the year at about 80.3%.
That's a very high score.
Yeah, so that's what my marketing folks tell me. But in the span of 1 year, we have gone to 86.5%.
There are not many organizations in any industry that make the 80s, much less the high 80s.
I'd like to say it's all related to this program, but we're taking a multi-pronged approach to this, but to the well-being and engagement of our colleagues. But certainly, I think the realization that our patients can't get what they need until our care teams get what they need first is foundational to our improvement.
Wow. And I think it's perhaps going back to, your original statement about HeartWiring. If we kind of heartwire what matters most for the care teams and the patients, most of the other things will take care of themselves in terms of the metrics, right?
I was just in a meeting and I said that to my team. I said, when you get great colleague engagement, everything else becomes possible.
Now, every day we read in Becker's Healthcare all of the financial pressure that many providers are under and strain that they're reacting to and so forth. I'm wondering, has that been impacting or Virtua, or has HeartWiring perhaps even mitigated some of that financial pressure? What are you seeing in that regard?
So there are so many things that are an offshoot of an engaged workforce. Turnover goes down significantly, and the cost of replacing a nurse, the cost of replacing a doctor is remarkable. And, we're a 14,000 person organization. As I said, we employ about 4,500 nurses and 1,400 docs. If we don't have to replace them, we're saving a lot of money. We're trying to become a more efficient organization for our patients. And in order to do that, we need to have docs and nurses who are engaged. People don't want to spend an extra day in the hospital. If we can keep them at home or get them home a day earlier or 2 days earlier, because we have a team that's focused on what matters most to the patient in that moment, they're going to be able to move that patient through the system faster. And that's exactly what we've seen in the last year. For the first time in our history, I think we're actually seeing really material decreases in the length of stay of our patients. And again, what patient doesn't want to be in their own bed? You have an engaged workforce, I'll say it again, anything is possible. And it's had incredible impact on our finances.
So here we've got a lot of folks listening who are either healthcare executives or healthcare, providers themselves. And perhaps they're interested in, hey, this HeartWiring sounds really great. Perhaps we could apply some of this in our organization. What advice would you have for them, for others that might want to consider following your example? Are there any important things to focus on or watch outs that you would suggest?
I think the first thing is to look back and honestly evaluate what you've been doing to this point. What's worked and what hasn't worked. I mean, we had to have a real honest look in the mirror with ourselves, and as much as we would have loved to have point at, it's our doctor's behavior, it's our nurse's behavior. It was really the leadership's behavior that was what we had to tackle first, and then it was about being able to show empathy and admit that things are rough for our colleagues. But you have to do so authentically. If you're just saying it, man, they'll see through that immediately, and then you're 10 steps backwards from there.
How did you kind of get that alignment among the leadership team? Was that something difficult or challenging to do, or Was this, kind of care team, coaching tips part of that, or how did that part of it come about?
I'll start out by telling you I have this physician advisory committee and about 20 docs who that I just bring problems to that I'm thinking about. And some of them are frontline leaders. Other are just sort of, doing the work. One day I brought like our HCAP scores to the docs, and I say, tell me what's going on. And one of the docs, after a long discussion, one of the docs says to me, Reg, just tell me what I need to do. Right. And that was like him throwing up his hands and saying, I've tried everything. And it was in that moment that I realized we had to think differently about it. And then I will tell you, Chris, when I did come, I found an organization that could help us in this regard. I didn't just bring it forward. I brought it to that group. We spent a couple hours together, vetting it. And at the end, I said, is this our path forward? So I got their buy-in. And then when I got their buy-in, I brought it to the nurses. And then when I got their buy-in, I brought it to some of my colleagues. In essence, I was hardwiring the meeting with my colleagues. By the time I got to the meeting with the other EVPs and our CEO, I could point to these different stakeholder groups that said, this is our path forward. So it was pretty easy.
Yep. And I'm guessing that the outside, group that you're referring to is Dr. Stephen Beeson and his team at Practicing Excellence. Is that right?
Yes, you're exactly right.
Big fans of what they do. They're all about kind of engaging the care team in getting their emotional needs met in just the way that you described. I've had an opportunity to be on his podcast as well. I would recommend it to anyone who's listening. It's called Practicing Excellence with Dr. Stephen Beeson. So I'm so glad to hear that has been a great partnership for you.
Yes, it has been.
Are there any quick fixes or low-hanging fruit that you would encourage others to kind of start with? So if we need to kind of focus on the care team first, what would be your first 3 steps if you were walking into another organization and wanting to replicate what you've been able to do at Virtua?
I think the most important step is to listen. Senior leadership cannot solve the problems of the frontline staff without truly understanding what it is. And so that means taking the time to meet with the different stakeholders and to authentically listen to folks, show them that you care about what they're going through, to get beyond the us and them thing that often exists between hospital administration and care teams, and then involving them in the solutions that you bring forward. It's the buy-in that is going to make or break this. And then the last thing I'll just say in that regard is that whatever you decide to bring forth, you've got to have your entire leadership aligned on this. There can be no error between what you're saying and what your other leaders are saying. Otherwise, those skeptics that don't want to participate or think that this is just another one of those flavor of the month type of ideas, they'll use that to their own benefit. And then I guess the last thing I'll say is, whatever you decide to go forward with, see what you can do to let the skeptics look at it first. A couple skeptics that you think might actually, the program might actually resonate with. And it's those skeptics that have been so important in our success because they became what I'll call apostles of practicing excellence. And when others look at them and see, while they've bought in, it gives credibility to the program.
I do have one more question for you, Reg, and that is, do you have a favorite quote? And if so, what is it and why?
The quote I'll use is one that I learned from reading a book about Steve Jobs. But it's a quote from his favorite singer, whose name I'm forgetting. You'll probably remember it when I tell you the quote. But if you're not busy being born, you're dying. I live by that.
Well, I think we're done with the questions at this point. It's been great to have you, Dr. Blaber. The progress that you've made at Virtua is really inspiring. And we look forward to hearing more about things that are going on at Virtua in the future. To our listeners, thanks for joining us as well. We hope you found this discussion informative and hopeful. Be sure to join us for our next Humanizing Healthcare discussion with Doug Salvador, the Chief Quality Officer for Bay State Health. You won't want to miss it.